We need to edit. Okay. So Adele, I'm just going to be checking your cranial nerve number 2. I'm just going to have you read this chart for me. I'm going to just place it right here. I'm going to measure out 14 inches on the eye. Sorry, if you don't mind holding right here for me. Thank you. Okay, if you could hold this. Thank you. Oh, can you cover one eye? And if you could just read the last most visible line for me.
428739 EWMOOX.
Awesome. If you could just switch sides. And then starting from here.
XOOMWE 937824.
Awesome. If you could just close your eyes for me. I'm going to be feeling on your face with an object, and if you could just let me know when you, just let me know if it feels even throughout. If you feel an area where it feels abnormal, please just let me know, okay?
It's fluffy.
That it is. Did you feel any unevenness?
No, it all felt even.
Okay. And you could open your eyes now. That's just checking cranial nerve 7. And if you could mimic what I do. So. Okay, and actually keep your, okay, thank you. And close your eyes. And don't let me open them. Awesome. And if you could just push forward, push back, push against my jaw, push against. Awesome.
No pain.
No pain?
Okay.
Okay, good. And also if you could just push against, put your arms up, push against, arms like this, pull, push. Awesome. If you could just squeeze real tight, you won't hurt me. Awesome, thank you. So my client was able to demonstrate strength equal and bilaterally just now. And when I was having her mimic my face, I was just checking cranial nerve number 7, the facial nerve. Okay, so I'm going to be checking your ears now. And I'm just going to grab the otoscope. Alright, so ears appear even on both sides. Yes, and if you could just tell me if you feel tenderness as I'm feeling on your ear. No?
No pain, no tenderness.
No pain, no tenderness. Awesome. Alright, and I'm just going to be looking in your ear at the moment, Adele, and I'm going to pull her pinna up and back. Okay, and I don't see any obstructions. Oh, and I see the eardrum, and it is shiny and translucent and almost like a grayish. Looks good, so the eardrum is intact. Sorry, I know it can get a little warm. Okay. Now, Adele, can you repeat after me? The cat jumped over the moon? Oh.
The cat jumped over the moon.
Okay. And if you could repeat the sentence I'm about to whisper.
Pots and pans and Peter Pan.
Awesome, and that is what I whispered in her ear. So her hearing is intact, as we can see. And I would demonstrate this also on the left, but due to time, I'm just going to assess one side. So I'm just going to switch out my cover. Because now I will be checking her nose and looking straight on. The nose is midline. I don't see any abnormalities. Looking straight on. Skin tone over the nose is evenly distributed. And I'm just going to look in to your nose. Okay. Oh, okay. And the nasal mucosa is red. And the turbinates are also red. I did not see any septal deviation. And I'm going to just check both nares. She only has one nose. And this is also, I see red. And turbinates are red as well. And I do not see any obstructions in there. Okay, Adele, sorry, could you just close one there? Alright, so. Okay. Close another there. So. What did you detect?
It smells really good.
Could you pick out the scent? It could be a little.
Not really.
Okay.
Just know that it was really good.
It's a vanilla Airwick. Little commercial plug. And I'm gonna just remove this top as well. And Adele, I'm just gonna be looking at your mouth. Appears pink. I do not see any cracks, so mouth appears well hydrated. And if you could just say ah for me. Awesome. Tongue is pink as well, and I'm gonna actually put on some gloves at the moment. Alright. Actually, I'm just. Are you allergic to vinyl?
Nah,
Okay.
not that I know of. I never tried to eat it, so.
Okay, well, hopefully. These are latex free. Do you have a latex allergy? Okay. Alright. So when she's saying ah, I was just checking her hypoglossal. And if you could just say ah again. Lift up. Alright. Soft palate is pink and soft. Teeth are white and they are intact. I do not see any abnormal spacing. Gums, Sarah, can you just smile for me? Gums are pink. Okay, they look good. And if you could say ah again, I'm just going to grab a tongue depressor. Say ah. Okay, I do not see her tonsils. I do see the uvula present. And I'm just going to check for the gag reflex. Okay, got it. Sorry. And now I'm just gonna check your hard palate. Okay. All right. The ridges are irregular, not regular on top, and it feels hard, true to its name. Okay. I'm just gonna get rid of these gloves. Okay, Adele. I am just gonna be checking your neck. And if you could just swallow for me. Okay. Swallow again, please. Alright, and I can feel the thyroid. Thyroid is intact in midline, as well as the trachea is midline and intact. And did you have any difficulty swallowing just now?
I don't like it,
Yeah.
but that was fine.
It was fine, okay. And I'm just going to check your carotid. Okay. So carotid pulse is palpable, +2. And Adele, I'm just going to ask you to take a deep breath. Okay, you can breathe out. I did not detect any bruit. And I am just going to assess your lymph nodes, okay? Please let me know if you feel any tenderness or soreness. So I'm checking her preauricular, non-palpable, posterior auricular, postauricular, non-palpable, occipital, non-palpable, submental, submandibular, jugulogastric, superficial cervical, deep cervical chain. Okay, posterior cervical. And you could just, okay, thank you. And her supraclavicular, also non-palpable. Awesome. So I was unable to palpate her lymph nodes, which is good, which is normal. All right, thank you.